I'm going to start with the introduction of this presentation. First, I would like to talk about the healthcare industry. The healthcare industry is also known as medical industry or health economy, which is an aggregation and integration of sector within the economic system that provides goods and services to treat patients with curative, preventive, rehabilitative, and palliative care. It encompasses the creation and commercialization of products and services conducive to the preservation and restoration of well-being.
So the U.S. spends more on healthcare than almost any other country and has the worst health outcomes compared to other countries, like lower life expectancy and the number of people with chronic conditions. And these findings, part of a study from the Commonwealth Fund. This is a foundation that studies healthcare issues, and it shows people in the U.S. are seeing doctors less often and spending more out of pocket than any other country. Researchers suggest in order to catch up with other countries, Congress would have to expand access to health care while making some aggressive changes to control costs.
The United States allocate a staggering $4.5 trillion to healthcare, averaging $13,493 per person, a figure ranking among the highest globally. Despite the considerable investment, the nation grappled with persistent challenges in healthcare costs and accessibility. Here are some challenges the United States has faced. First, financial strain. The weight of high healthcare costs bears down on families, resulting in delayed care and adverse impact on overall health outcomes. Second, affordability woes. Access to essential medical care faces obstacles due to excessive price, propelled by escalating pharmacy costs, administrative complexities, and a lack of price transparency. Next, tech advance and costs. Innovative healthcare technology enhance patient care. These progress come at a financial cost, prompting healthcare providers to navigate the delicate balance between investment and affordability. Lastly, access option. While options such as payment plans and financial support exist for those contending with healthcare costs, there remains an urgent need for comprehensive reforms to address the root issues.
In terms of fragmented healthcare system, one of them would be the diversity of the insurance system. Well, there are plenty of private and public insurers that offer different coverage plans, such as benefits and reimbursement rates that simply leads to a complex landscape. Thus, there is a lack of standardization and at the same time consistency in healthcare delivery. Furthermore, when patients switch their insurance plans or providers, there may be disruptions in their medical care. So, it is challenging for them to create an efficient and well-coordinated healthcare practices due to the administrative difficulties brought on by the lack by a single insurance of a system. What comes second is the limited access in rural areas, small numbers of hospitals and clinics causing an increase in the time and the financial burden on individuals, while at the same time delaying the proper medical treatments. This increases the time and financial burden on individuals while also delaying the medical treatments to arrive. Healthcare inequalities are also worsened by the lack of healthcare resources in rural areas, where individuals may simply suffer from worse health outcomes as a result of delayed treatment for serious illnesses and at the same time limited access to preventative treatments. Last but not least, over-specialization. The human body is a maze-like complex organism. A doctor may be extraordinarily knowledgeable, but it is impossible to simply understand everything about the body well enough to diagnose a specific problem. Having a multiple specialist can contribute to a lack of consistency and at the same time communication. and end up making it super hard to maintain patients' overall health. In addition to lowering patient satisfaction, the system had emphasized on a specialized treatments rather than a fully integrated care that raises healthcare costs, create inefficiencies, and makes it more difficult to promote the general health and well-being of patients.
Okay, I will continue with the conclusion. In conclusion, the high cost of healthcare in the US is a complex issue that attributes to factors such as medical care price, unregulated prescription drug costs, and high healthcare provider salaries. Rising pharmacy costs is a fragmented healthcare system with a complicated administrative procedures. And a lack of price transparency are just a few of the many interplaying elements that contribute to this problem. This leads to financial burdens, hindering access to necessary service and impact health outcomes. Reform are urgently needed to make healthcare more accessible and affordable for everyone. So that's all for the conclusion.